Hi there, Dr. Tansavatdi here. Today I'd like to answer a frequently asked question that I get regarding eyelid surgery, and in particular upper eyelid surgery. So how do you determine if you're a good candidate for upper eyelid surgery? Well, there are a couple factors that I like to ask patients, and the first thing has to do with the difference, and I'll split it between women and men, because women will experience certain things that kind of key them in to whether they should have upper eyelid surgery. And number one is if you use eye makeup, when you go on to put on your mascara, if you're constantly lifting your brows now to put on the mascara, that's one indication that you might be a good candidate for eyelid surgery. Second way would be if you're putting on your eyeshadow and you're noticing that it's just bleeding onto the lashes or bleeding to other areas, and you can't really get the eyeshadow without lifting the brow, that's a good indication you might be a good candidate for eyelid surgery too, for upper eyelid surgery. The other thing that you want to look at is the position of your brows. So sometimes people want to go for upper eyelid surgery, but they're a better brow lift candidate. And so the brow, the position, if it's within the lashes, if it's about half of an inch between your brow and your upper eyelid lashes, that might be too close to have upper eyelid surgery, and you might be a better candidate for brow lift surgery. All right, now let's move on to men. So my male candidates are usually those who start to notice that the skin itself is starting to hood over their lashes. They see it where it's hanging on the lashes. It either feels heavy, or the second thing that can happen is they're now starting to notice that's affecting their vision. So what are those typical things that they'll discuss? They'll say, oh, you know, when I'm looking up, it feels like there's something blocking my vision. Or I have trouble by the end of the day, it feels really heavy. Or when I'm driving, peripherally I have some issues seeing out in the side of my vision. Those are typical descriptions explaining why the upper eyelid is now causing problems with your vision. So there you have it. Those are the typical great reasons for having upper eyelid surgery, and to determine if you're a good candidate for upper eyelid surgery. Thank you for tuning in. For more information, please tune in to our YouTube channel at Faces by DRT1 or other social media channels at Faces by DRT. Thank you.